That announcement from the Premier dominated much of her visit today in Ottawa, with federal ministers accusing Smith of, quote, demonizing trans kids. The Premier is in Ottawa to open an Alberta office and sound off on federal climate and resource policies she's vowing to fight. The Premier joined me in studio this afternoon. Have a listen to our conversation. Hi, Premier. Great to have you here in studio.
My pleasure.
I really appreciate you making the time. I have a lot of questions for you about the purpose of your trip, which is, of course, to open the Alberta office here in Ottawa, your relationship with the federal government. I actually want to start, though, on what I'm sure you're expecting is kind of the new point of friction between the federal government and yours, and that is the suite of gender identity policies that you announced your intention to introduce in the fall. I wanted to start off by asking what problem you aim to solve with those policies and potentially legislation.
Look, I have heard from transgender Albertans. One in particular has me very concerned that she felt like she was pressured into making a decision on surgery faster than she otherwise would have, and has had nothing but problems in the 14 years since. So when I look at that somebody who began their transition as an adult feeling like they didn't have enough time, it got me concerned that we have to make sure that young people, as they're making these life-changing decisions, have the maturity to know what the consequences are. So there has been a growing discussion around the world about at what point kids make these decisions. If you look at the UK, and they've closed down their Tavistock clinic. The Netherlands is taking a bit of a reversal from where they began. Same with other Nordic countries. We thought it was time for us to have the conversation as well, and to make sure that when kids do make those kinds of decisions, many of them irreversible, that they have the maturity level to know what the consequences are.
My understanding, though, in reference to the anecdote that you're sharing, when you shared it earlier today, was that individual was over the age of, I think they were
Correct.
19, right? So over the age of 18.
Yeah.
Your policies specifically target kids who are under 18, especially
Right.
in the case of banning gender-affirming surgery. Are you aware of kids in Alberta under 18 who have received that surgery without parental consent?
The surgery, they do top surgery, yes, in Alberta, not bottom surgery, but there has been some organizations advocating for those treatments to be done younger and younger. And I guess I'm not comfortable with that, because if even an adult at 19 started the process and felt that she wasn't ready to make those decisions, it makes me wonder, how does a younger person feel? So you have to have a certain understanding, you have to go through a long process, and I just want to make sure that the protocols are in place so that every child is protected. I don't want any child to feel regret for their decision or feel that they made it prematurely. And so that's why we want to make sure that we take the extra time so that those kids are making the decisions and they can live with the consequences.
And I think that sentiment is really understandable to a lot of people who are listening. But my question was whether you had any evidence to base your policy on, specifically as it relates to kids under 18 in Alberta who are doing top surgery without parental consent. Because we asked your health ministry, for example, they were able to tell us that 26 Albertans in 2022 and 23 in 2023 received top surgery, those who are under the age of 18, but Alberta Health doesn't track whether those surgeries are related to gender identity or for medical reasons like cancer or breast reduction due to pain. So are you basing it on a concern of what will happen or actual evidence of what is happening?
A concern of what will happen, because as I mentioned, one of the organizations internationally has now suggested a lower level of age 17 for starting surgery. And we just having seen some of the stories that I've had, I think that when you're going to make those kind of life-altering decisions, that should be as an adult. We do also, though, want to allow for those kids who've already started the process and those who are 16 and 17 to start down the pathway, because that's a level of maturity that I think many doctors believe that people can start making their own decisions. So we want to make sure that we're preserving the choices for kids. That's what this is all about.
But are you preserving the choices for kids? Because you're, again, now saying that you don't actually have evidence to support the position you've taken. You're just worried about what could happen. And aren't you removing the choice of parents who do think it's okay for their kid to get that surgery at 16 or 17 years old?
I guess this is the trouble in this whole world, is that there isn't evidence to support the decisions that we've made so far. The Tavistock example is one where I think they've had 9,000 kids go through, and they don't do long-term tracking of what the results are of those children. The only study that they've done is, I believe, a a study from the Netherlands that only followed 44 kids. So we've allowed the medical profession to make a lot of decisions without scientific evidence, and that's why I'm a bit concerned.
The medical profession is making decisions without scientific evidence.
Yeah,
Aren't they making them exclusively based on scientific evidence?
I wish that were the case, but that's part of the reason why the Tavistock Clinic was closed down, is because there was some concern that kids were making these decisions without having the appropriate level of time and the appropriate level of medical involvement. And so we want to just make sure that's not happening here. We don't want any child to be in a position where they're having a regret because they've made a life-altering decision. So we just want to make sure that we have the extra time so they preserve their choices.
In the case, though, of Tavistock, for example, it's not going to close until March 2024. The closure was delayed. And in its place, there will be 2 other regional clinics. They're not outright banning and going as far as you plan to with your government. So why are you relying on them and that example to back up the point that you're making or the policy you're pursuing?
We're not banning anything either. We're just
banning gender-affirming surgery for kids under 18.
Well, that's always been the case for bottom surgery, and it has been the recommendation for top surgery. It's only recently that has been changed, and we would just want to make sure that, and only by one organization. As I said, I know that there's this idea that there's only one right answer, and there's only one way of looking at this, and that's just not the case. There's been a robust debate on this for the last number of years as problems have emerged, and we just want to make sure that we don't end up with the same trouble. We don't want to have any kids feeling regret, feeling like they were rushed, feeling like they made a decision without knowing the full consequences, and that just takes time.
Even if their parents offer consent? Like, even you're willing to say that the parents who offer consent for their children to go through these procedures should not have that right?
Well, I would say that the person who should make the decision is the person who's going to live with the consequences of it. It's not up to a doctor, it's not up to a parent, it's not up to a politician, it's up to that child. And that child has to be of an age and maturity that they know the consequences of what they're doing.
And you don't think that a child at 16 or 17 has that perspective?
Oh, at 16 or 17, that's when they would begin the process. And so we're supportive of kids being able to, with the psychologist support. Most of these teams are multidisciplinary, doctor support, psychologist support, and support of their parents, going down that pathway, and that can begin as soon as 16.
But you can't get surgery at that age. I think you're presenting it as, okay, you could start taking hormone blockers once you've gone through puberty, which are specifically supposed to be designed so that you don't enter that stage. But you can't get surgery. I mean, what you have proposed here is very specifically that kids under 18 will not be able to get that surgery.
Correct, and that has been the practice in most jurisdictions, not to allow surgery that will end the reproductive. In Canada, there's no jurisdiction that
for bottom surgery.
For bottom surgery,
there is.
And I guess that's the question of whether or not that's appropriate. I mean, when you decide to have babies as a woman, you may want to be able to breastfeed, and so when you're making a decision to have a double mastectomy, that's going to also have lifelong consequences. So we think that those are decisions that are adult decisions made at 18.
And a parent can't make that decision on behalf of their child.
No, I don't think that anyone can make a decision about what the reproductive health should be, except for a person who's going to suffer the consequences of having regret. And so we just don't want that to happen. We want kids to be able to fully understand all of the decisions they're making.
In the interim between now and when this is introduced, if you do hear from people who feel like we did over the weekend, for example, this makes them feel as though they can't be who they are, that they will be further subject to bullying. This is a group of people, for example, that are 7.5 more times likely, according to the most authoritative study on the subject, to try and commit suicide. If they do feel like these policies are making that more likely or putting in that position, are you willing to change course at all if you do hear in the interim during a consultation process that is the case?
These are very vulnerable kids, and there is a higher incident of mental illness. There's a higher incident of suicidal ideation, and that's why they need to have their families around them. They need to make sure that as they're going through this journey, that the people who are going to be there with them for life, which are their parents and other adult loved ones, that everybody's involved in understanding what the child's going through. And so that's what we want to make sure is that that happens, that there isn't any division between the child and their family, and that they're making the decision at an age where they're mature enough to handle the consequences.
Do I interpret from that you are not open to any changes, regardless of what you hear from the people who will be most impacted by these policies?
Well, look, I've been consulting widely on this issue for a long time, because I found when I was in politics the first time, I had transgender constituents who were telling me how difficult it was to get a doctor to be able to give them the lifelong hormone care that they needed. When I've spoken with Lois Cardinal, the concern that she had to go to Quebec to get her surgery and then didn't have appropriate aftercare. We've got to solve those problems too. We've got to make sure that trans adults are supported with their health care for the rest of their lives. And so if there are other ways in which trans individuals can feel supported in their health care decisions, then of course I'll be open to those ideas.
Have you opened yourself up to the criticism from your opposition and from federal Liberals as well, that this is primarily about doing well in your leadership review and satisfying a certain aspect of your party, given, to be fair, the lack of evidence you've been able to present even during this interview about why you pursued this policy?
Well, I've given lots of evidence. You can reject it if you like, and that's fine. But I think we have to understand that parents want to know what's going on with their kids. That's fundamental. They want to make sure that as their kids are going through these difficult challenges and trying to figure out who they are, that there isn't any division. They want to be informed, and they want to walk with them step by step. It's why we've also talked about having an additional support for the parents so that and the families so that they can be involved in the process as their child is making these choices. So no, I think that this has been an active discussion in the world for the last number of years. And if there's a need to recalibrate to make sure that kids are protected in all their choices, then that's what we have to do.
But you have been lobbied by the super conservative flank of your party, by Take Back Alberta. One person wrote on social media how this was a victory of sorts for them, and they noted that a meeting that they had taken with the chief of staff for the education minister. Again, I understand the anecdotes. I understand the sentiment, and I think a lot of parents listening do as well. We want to protect our kids 100%. But if it isn't actually a problem, if there isn't a huge uptake of these surgeries, if you don't have the data to tell Albertans this is the problem I'm actively solving, then again, why wouldn't your critics say you're doing this just for political reasons?
Well, you look at the New York Times article that came out a couple of days ago, and they say 10% of kids detransition, 20% stop transitioning. It's 30%. And if that's the case, that's a big failure rate. And that has a huge impact on those kids' lives. I don't want a single child to regret the decisions that they made or feel like they made them prematurely. We want to make sure.
Even if you don't know if there's a single one that's done it in Alberta.
I think that what you're trying to imply is that this hasn't been a conversation for the last number of years. It has. There's been discussions all around the world on this. There have been discussions all across Canada on this. Angus Reid did polling on this of all Canadians and found that it's the same thing. Parents want to know what's going on with their kids, and they want to be involved in these processes and this discussion as kids are making these changes. And that's foundationally what we want. We want to just preserve that parent and child relationship. It's vitally important.